Fantastic. Well, it is right on the hour, and I would like to get going for today's webinar. So, hello everyone. Welcome to the NFA Performance Healthcare Committee's Q&A webinar. My name is Simone Mora, and I'll be serving as the moderator for the panel today. We're so glad that you can join us. And we're going to begin by giving brief introductions of the committee and each panelist, and then we'll open the floor to any questions that you have. You have a number of ways of asking questions in today's panel, depending on the level of anonymity you prefer. If you would like to be anonymous with your question, you can send a direct message to myself in the Zoom chat or any of our panel members. So a direct message will indicate that you have a question, but you do not want your name read out, and we will not include your name with the question. If anonymity is not needed for you, then you can send a Zoom message in the chat to everyone. You can also use the raise hand feature, and we can hand over to you to verbally ask a question if you prefer as to typing. So I will continue to remind us throughout as more people join us or as attendees change. I'll just remind us of how you can ask those questions there. But in the chat, direct message for anonymity and sending to everyone or raising your hand if that's not something you need. I'm going to start the introductions of our panel members today. Again, my name is Simone Mora, and I, like the other panelists today, am a member of the NFA Performance Healthcare Committee. I'm a registered somatic movement educator and therapist, and I'm a university researcher in music psychology. I bring to this panel expertise in musician somatic and psychology wellbeing, embodied cognition, and performance science research. Our other panelists and committee members today are Rena Urso, Stephen Mitchell, Maria Gabriela Alvarado, Jacqueline Dove, and Chip Shelton. And in that order, I would like to call on committee members one by one to give a brief introduction of who they are and the expertise that they are bringing to today's panel. Rena, may I start with you?
Yes. Hi, everyone. My name is Rena Urso. I am based in Chicago, but live sort of globally these days because of the necessity of the work that I do. I'm a flutist and an educator. I'm a licensed body mapping educator and a yoga teacher and meditation teacher. And in addition to working privately and in workshops around the world, I have a course, well, it's really ideally designed for any performing artist, but it turns out right now it is only being occupied by music students at my university, Cal State Long Beach. And I'm very passionate about this work because I have been injured for more years of my career than I've not been injured. So, you know, necessity is the mother of invention. So I'm happy to be here with you all today.
Thank you so much, Rena. We're pleased that you can join us as well. I'll hand now over to Stephen.
I'm Steve Mitchell. I'm an otolaryngologist in Nashville, Tennessee. Also married to a flutist and a flute choir director. So I kind of got into flute repair business sequentially. I was one of the founders of the Performing Arts Medicine Association, one of its former presidents, and I've been associated with this committee for almost 40 years now, back when it was called the Dysfunction Committee, if you can believe that. So here I am.
Thank you so much, Stephen. I'd like to welcome Maria Gabriela.
Hi, everyone. I'm Dr. Gabi Alvarado. I am a flutist and an educator and career coach. I'm currently based in Boston, Massachusetts. I work for the Longy School of Music as their community engagement manager. I got involved in the work of performing arts health as somebody suffering from Ehlers-Danlos syndrome. I have dealt with a lot of hypermobility issues, and in my time as an educator, I continue to see hypermobility here and there, and many flutists. And that's how my research and work started and have been continue to grow as more people continue to be diagnosed with Ehlers-Danlos syndrome, I say.
Thank you so much, Gabby. We'll say hello to Jacqueline.
Hello, everybody. So I'm Jackie Dove. I'm a professor of anatomy and physiology, mainly in Waco, Texas. I can teach anything in the public health sphere. I've taught a bunch of different classes, you know, from human diseases to, you know, ex-phys and stuff. I am a clinical exercise physiologist, so my background in the hospital was with open heart patients. Open heart patients right after surgery, and then respiratory patients. And then I got my doctorate, my specializations in exercise nutrition. And then I went on to do a postdoc in psychology neuroscience, and I delivered hypnosis intervention for the treatment of hot flashes in postmenopausal women. So that's an NIH funded study that we did at the Mind Body Medicine lab over at Baylor. So real impactful work. I've been to India a couple of times, so I went to school there for training to teach hatha yoga. I prefer to be a student, though. I think I teach too much, you know. I just need to be a student sometimes, so I don't teach. And then and meditation. I also have some medical conditions that involve like a lot of pain. So I have fibromyalgia, but I also have like some nervous dysfunction, a lot of hyper sensitivity, exaggerated reflexes, and you know, atypical response stuff. And so when I started playing music again, I took a 25-year hiatus. When I started playing again, I really wanted to hone in on how to just best protect myself. And then, you know, through joining NFA and also PAMA, you know, I've really become passionate about making sure that we can protect musicians. I think that's the biggest thing, right? Is that it has such a tremendous impact on the brain and cognitive reserve that we need to keep people as healthy as possible so that they can keep playing. So thank you.
Thank you so much, Jackie. And I'd like to introduce our final panelist for today, Chip.
Hi, I'm Chip Shelton. I'm a board certified orthodontist. Area. I've been, let's see, also I studied classically in the early 90s with Julius Baker, who was known at that time as the Dean of American Flutists. And I've been on the Performance Healthcare Committee since the 1990s. As a matter of fact, I'm wearing a 1995 NFA in Orlando t-shirt right now. I don't know if you can see it. I have some videos, I think, on our we call it our health-related, dental-related articles, and co-authored one recently about, you know, coping. Should we get braces as flutists and coping with them when we have orthodontic treatment? So happy to be here and looking forward to the panel. Thank you.
Thank you, Chip, and thank you to all of our panelists for introducing yourselves. At this time, we would like to ask our attendees to get their questions ready. We'll give you a few moments. If you're tip-tapping it out on your laptop keyboard, you can also raise your hand. I'll remind you of the channels you can ask your questions. If you would like to ask an anonymous question, that is a question that will be read out without your name attached, then feel free to send a direct message to either myself or one of the other panelists. Your question will be read out without your name. If anonymity is not something you need, then you can still ask your question in the chat, but you can address it to everyone and we will discuss the question there. You are also able to use the raise hand feature if you would like to verbally ask your question. So please Put your questions in the chat. We'll give you a moment now. Welcome to those of you who are joining us. We have just given a quick introduction around the panel. Our panelists today, I'm moderating. My name is Simone. We have Rena, Chip, Jackie, Gabby, and Stephen as well. So now is the time to type your question, raise your hand, and there are a number of ways you can do that. If you're unsure about anything, feel free to ask for a repeat of instructions. So we'll have a moment while we wait for questions to start rolling in.
I think Beth raised her hand.
Yes, do we have a raised hand? Please go ahead.
Beth Devlin.
Hang on, Beth, I think you're still on mute. Yeah, you got it. Almost there.
There we go. Hi, everyone. I was wondering if I would love to see some kind of panel discussion at the NFA. I know I personally have gone through cancer diagnosis and treatment, and there have to be a lot of other people. And I think it would be a really great way for people to start opening up about some of the different things they might experience during those processes. You know, and I'm not exactly sure. Like, I think this would be a great committee for that to originate from. You know, even if it's yeah, I think a virtual session might be a little easier, or sometimes they have like the meetups or anything. And really any type of, I'll say, long-term type of illness, because it can be very devastating.
Absolutely. Beth, maybe we can have start a discussion here. Thank you so much for your suggestions as always. We do have people on our panel who I believe would be able to talk about chronic illness, long-term chronic illness or illnesses and flute playing. Do we have anyone here?
Yeah, we covered this. This is a very important issue, and there were a couple of NFA annual meetings that we had several of us on the committee presenting this topic in terms of the long-term illnesses, aging, and all the effects that it has. Also, the side effects of many of the medications that you're obliged to take, and the side effects that mess you up from those, whether they happen to be neuromuscular or drying of the mouth or shortness of the breath or inability to visualize or focus on things. So yeah, it's a very involved issue. It's one of those that obviously we couldn't possibly cover in this 1 hour. And even cancers, and you're dealing with pulmonary cancers, which will take care of the shortness of breath, the neurologic cancers, which will deal with your coordination, the abdominal ones where you just can't breathe, and not to mention the bone cancer. So it's a very, very involved issue, and we could certainly it'd be good for the committee to kind of nibble away at it, kind of like eating an elephant. You're going to have to kind of nibble one little chunk at a time in order to do it justice.
Indeed. Thank you very much, Stephen. Would any of our panelists like to include further considerations or perhaps a specific area that they're knowledgeable in?
Well, I may be off base here, but Beth, also what I was thinking when I was listening to you, also is just feeling like you're not alone. I think that that's one of the benefits of just like bringing it up, like in a conference setting, you know, where people can ask questions and stuff, because it's so isolating, and people, you know, can feel so alone, you know. But I mean, maybe even as like a committee, like we have a booth, we could have little handouts and stuff, you know, to summarize some of these things that keep coming up, you know, in terms of consistent questions that people have. Because with, you know, like Dr. Mitchell has said before, like with aging, some of the medications, the side effects of medications have big impact on people too. And that might be something that they're questioning, that they're having to go through, you know. And normalizing this discussion, I think, is wonderful first step, right? And so thank you for all of you for coming, right? Because we couldn't do it without you to come here and bring questions, you know. but it helps everybody know they're not alone.
I will echo what my colleagues have just said, Stephen and Jackie. And I will add, one of the things I do is I teach a gentle yoga class that is primarily elderly people, people that are recovering from an injury or surgery or illness, people that are getting ready to go in for a hip or shoulder replacement surgery, and they want to be in the best possible place they can be preemptively. So it really is kind of this catch-all class for a variety of people working through different things. And I'll tell a very quick story about a couple of my students that are, I would say they're probably late 70s, early 80s, and not flutists, but they're going through or just completed their round of chemotherapy and radiation and trying to regain their strength and mobility and freedom of their breath and all of these things. And I love these two little ladies because they come to my class twice a week. And the very first time one of them came, she couldn't get down and back up again. And now they're there twice a week for 45 minutes, and they're doing what they can. They're connecting with their breath. They're sitting and meditating, even if it's only those 2 times a week that they're sitting in meditation and finding just some stillness and peace and finding a little bit of quietude in their mind, but they're also moving their body very gently and very mindfully. And it's really this step-by-step process to help them. And it's helped me to help other people. And I'll also add a quick story. My sister recently went through breast cancer, and she's good now, but also not a flutist, but I offered her some of these tools as well. And she said, I completely forgot about how useful meditation and gentle yoga and restorative yoga could be for my body. And it's been a help for her. So these are just a couple of tools to maybe help along the process.
Thank you so much, Rena. I think that's really beautiful. I'm envisaging perhaps how we can move forward. Beth, you've mentioned perhaps a meetup. I'm assuming that might be at one of the NFA conventions, or the webinar, that we have a lot of diversity in how we can connect with people, but a session for connection. As Jackie was saying, not to feel alone. As Stephen was mentioning, there's a wide variety. So to hear firsthand from people who have this experience, if they're of course willing to share. But I think perhaps our committee could help open up a space, whether that be in person and or virtual, to hold space for people to talk, to connect, to share, to learn, and then perhaps a session following that with some gentle movement, meditation, or something like that too. I'm sort of imagining a hybrid session perhaps there. I'm sure if other committee members, we should absolutely continue and talk about this. I'd also like to just ask if Gabby would like to contribute something towards this topic on chronic illness as well. I'm aware that you're very experienced and knowledgeable in this area of other chronic illnesses. Would you like to add anything?
I think a lot of you have already mentioned some of the things that, like, for me as a professional flutist, at the beginning was very hard to deal with. Is like feeling like you don't belong, feeling like you have to explain to people. Like for example, rehearsal length. I'm really sorry, my dog is playing in the back. I don't know if you can hear the noise. Sorry, 1 second. I'm sorry for the interruption. He's needing a lot of attention. Yeah, rehearsal, like the length of the time that you're playing during a rehearsal. For somebody with Ehlers-Danlos syndrome specifically, I deal with a lot of dislocations, and like movement of my ribs. The ribs get out of place and therefore don't allow me to breathe properly. So I would definitely echo what Rena said about sometimes just like breathing, and meditation focuses like on a lot of breath, right? And it's not like we're trying to here to change your mind about everything. It's just reminding yourself of what breath can bring to you, and then taking that technique into your playing. I myself had to do a lot of yoga, Pilates, and I learned a lot of body mapping to understand what happens with my body when I play, and how I can help myself have a longer career as a football player. There's also a lot of other stuff that when it comes to chronic illnesses, but I would say if I've learned of anything during my time, and especially as an educator, listen to your body and feel empowered to stand up for how your body feels. If you need to rest, ask for it. If you have to back out from a production, it is better to do that than to then have to deal with the negative effects that can bring to you.
Thank you so much, Gabby. Yeah, advocating for our own health needs can be very isolating, and I sort of see that connection of when it can feel so alone. If you feel like you're the one who can't continue in a rehearsal, or you're the one that has to continue being absent, or and it can feel like we're sometimes subpar in a way, or we're not able to keep up with everyone else. So I think this is a conversation and something that the healthcare committee can advocate for, can make space for, to have these conversations, to bring people together so that they can feel connected, that they're not alone, that learning how other people advocate for themselves, learning how they support themselves through, whether it be breathing, meditation. There are lots of somatic practices that we can engage in. So watch this space, I think. And Beth, thank you so much for bringing that up, because it's very worthwhile, and I'm sure there are many people who would love to be involved. We can return to this later on as well. I see we do have 2 questions in the chat, but actually Jackie would like to, you want to
That's what I was going to
address?
say. There are a couple of questions that popped up, and I'm
So I
not
see we have,
qualified for all of it. So I don't know if the group can see the questions.
yeah, we'll start with the first one, talking about, I'll just read it out. I have essential tremor in my hands, primarily. I am 57, wondering mainly if anyone is familiar with this condition and how it might affect flute playing. Panelists, do we have anyone who would like to start us off?
I'll be the first to admit I'm not a neurologist, and we have some orthopedic surgeons and some neurologists on the committee, and they'd be the ones to run this by. Essential tremor, the problem is that it's one of the things that will occur a lot of times because of age. As we get older, certain parts of our body kind of poo out faster than others. And it's very unfair. It doesn't matter who you are. Some people it won't happen until they're in their 90s, and other people will happen when they're in their 50s. The key is that it can affect your flute playing. Surprisingly enough, the concentration on playing the flute tends to reduce it. You tend to have more of the tremor when you're at rest, not doing anything, and yet when you're doing a task, a lot of times you overcome it simply because the muscle movements you're having are considerably more extensive than just sitting at rest. And so that's the first thing. You can certainly need to consult with a neurologist, most likely, because you want to be sure it's not indicative of something else further. This is the old a stitch in time saves 9. And so if you can find out what something is beforehand, great. But the one thing I would admonish you is to educate your doctor on you, because most doctors have the foggiest idea what a flutist does, what a flutist has to do, and how horrible their medications can sometimes affect you. And so you need to keep them in the loop and make sure they know as much about a flute as anybody else does, because quite frankly, if they don't, you're going to get screwed up. And so you're going to have to advocate for your own, you're going to have to be assertive and advocate for your own health, which means you're going to have to do the book learning about it, because you're going to be teaching your doctors about it. And so that's the first thing you need to bear in mind. So don't just hop on a pill and pop a pill, because next thing you know, your tremor is going to be worse, your headache's going to be worse, you're going to have muscle fatigue, you can't focus on anything, and your mouth is dry. So just be aware of that.
Thank you so much, Stephen. Rena.
Wendy, and in the spirit of complete transparency, which I think is important in this committee for sure, I am close to your age, and I have a non-essential tremor in my left hand. And it was diagnosed. I've gone to many doctors, and like Stephen just said, I feel like I've had to teach a lot of my doctors along the journey. It's been there for about 20 years. I've had to teach them about what it is I do. I've had to bring my instrument in and show them the way in which I sit and stand and play my instrument, the way I breathe, and everything from my primary care to nurse practitioners to pain specialists to kinesiologists, like you name it. And the overwhelming response from them is sort of a scratch of the head, like, yeah, I don't know what to tell you. Is it getting worse? No. Is it getting better? No. Does it hurt? No. Yeah. So they don't have any answers for me. They've never had any answers. So I've, like Stephen just said so eloquently, you got to be your own advocate. And what is helpful, I think that might be helpful for you, is to really watch it, to understand it, to know how it behaves, to know as much about you and this thing as much as you can, because it helps you to educate the people that you see that might be able to give you some answers or some guidance. Mine doesn't get worse. It doesn't hurt. It doesn't get in the way of my instrument playing, but I have a heck of a time eating soup because it's in my primary hand. So eating, like pulling that spoon of soup up, it's like slopping all over myself. So sometimes it's a little challenging in that way, but it doesn't get in the way of my flute or piccolo playing. And I'm a professional player. I play all the time. It doesn't get worse by my playing. It doesn't present when I'm playing. It presents away from my instrument more than anything. So I don't know how much that is helpful, but other than just to reinforce Stephen's statement also, which is there are some people on our committee that are specifically trained and skilled and educated in this area that may have some more guidance and answers to offer you.
Thank you both. And yes, our committee can be emailed specifically about concerns or medical conditions anyone would like some further information on. At the end of the session, I'll put our email address in the chat so that you can know exactly who to email if you'd like to follow up further. At this point, do we have anyone who would like to add on to the discussion there? We do have some other questions it might be worth pushing through now. We can circle back to any of these. Beth, do you have a raised hand?
I mean, I know I'm not part of the committee, but when I think of tremors, I wonder if there's some fear of like your instrument dropping. I don't know if that's part of how it presents when you're playing, Wendy, but in low flutes especially, they often have you put like a man has to stand with a towel, so that way at least maybe if that is something that was part of it, it could help support your instrument so you don't have to do all the supporting and maybe help, so maybe if there are tremors, it could help stabilize it.
Yeah, thank you very much, Beth. I'll just put into the chat now, by the way, our committee email address. You can circulate that again at the end. But for Wendy or anyone else who would like to contact other committee members who aren't able to be here at the panel right now, please feel free to send through an email, because we do indeed have access to some really wonderful healthcare professionals who can certainly talk to you in depth. Well, I think we'll continue on. We have a two-part question from Catherine in the chat. I'll read it out. It says, I twist to the left when playing, but as I'm getting older, it hurts at the end of a long rehearsal. Should I just turn my head to the left? And then a clarification. Actually, I mostly just turn my head, but maybe it's just keeping my flute up for 2 hours that's taxing. and the muscles in my upper back get very stiff. And I can appreciate this. I think if I may start this off, we hold and play a very asymmetrical instrument. So a really good reminder is, are we balancing out our movement and our muscle groups weight bearing movement? So just a quick tip to start off, and I have to remind myself of this all the time. Am I doing the similar weight bearing, weight loading movements on the other side of my body to balance out the asymmetry that we have when we play the flute? And so this is just something I've had to not only learn but continually remind myself to do. And I do notice when I'm starting to get and I'll feel it in one shoulder and one hip, the very sort of diagonal asymmetrical line through the body. And when that starts playing up, I have to remind myself, oh yeah, actually, if I've been playing my flute like this for hours and hours and hours, how am I balancing that out? Is my body getting back closer to its equilibrium? I don't think my body will ever become symmetrical again. Maybe it wasn't there to begin with at the start. But I just like to start that conversation off, that we do play a very asymmetrical instrument. So keeping that in mind is very important. So consider how you are supporting your flute playing outside of flute playing as well. Perhaps we have some recommendations from our panelists on specific exercises or movement patterns that they like to do to support our asymmetrical instrument.
Well, one of the things that's good to remind us, although we hate to admit it, the performance care and instrumentals, it's a branch of sports medicine. Okay, whether you want to admit it or not, you're jocks. Okay, and that means that you are using the same muscles, tendons, and everything else that a tennis player is using, a football player is using, a ballerina is using. And consequently, we're blessed because we've got a lot of people who have a lot of expertise in exercise physiology and different methods of relaxation. You also have these little things called smartphones, and you can video yourself, which can help a lot, because I can guarantee you won't have the foggiest idea what you're doing unless you video it, because you can't play music and look in the mirror at the same time. And a lot of us don't like to pay to have a teacher do it for us. So there's a lot of aspects on this that are kind of vital, but just make sure that you don't think you can be a couch potato and be a flutist. No way.
Just to plug some exercise maybe for a second, since we are on that track, because I have to deal with a lot of things. We right behind me, I don't know if you can see right there, I have a vertical climber, and it's wonderful, like, and it folds up really tight, and I really have to think about prepping and, you know, stretching out before a rehearsal, right? Just like if you're going to go run a marathon or a 5K or whatever, you have to get ready for it. And we do remember we are small muscle athletes, right? And I have to prep before a practice or rehearsal, or I'm really going to hurt. And that's another thing too. I had to give myself permission to take medication sometimes before it was, before meditation, actually, one time I was hurting so bad, and I was like, just stop and get some medicine. It is okay to do that. And for me, that was a hill I had to go over, to give myself that grace to say, sometimes I just have to take my meds, whether I want to or not. And I think that's where we just have to just be real intuitive and honest with ourselves. And if you're not in the greatest place, that's okay. Manage and just keep moving forward, but try to get the best out of that rehearsal so that you're not compounding the problem. And I think that's the other thing, is it's like we don't address and acknowledge it because we are athletes. It just gets worse and worse over time, and then we're having to deal with a bigger problem. And which is why all of a sudden I was like, oh yeah, I should relax my jaw. Thank you for bringing up, there's somebody asked the jaw question. I was like, oh yeah, I should relax my jaw. And I'm like, is my neck supported right now? Because if there's problem areas and you're not playing at the moment, like, what can you do through the day to support those areas that when you do play later, it's not going to be as hard. And for me, neck support's a big thing. Like having a couch that's tall enough that supports my neck is really important for me, and practicing for sure. Yeah. So I hope that's somewhat helpful.
Absolutely. Thank you very much, Tiffany.
After I had studied with Julius Baker for a while, he said to me, to perform at an upcoming class, and he assigned me a piece to perform. And the first time, I was really motivated to put a lot of hours in preparing, because I was intimidated. I mean, he had people performing like Gary Shocker and young Gary Shocker, and a lot of other, Mimi Snillman. You know, for the first time, I experienced a lot of discomfort and eventually type of pain. But I got through it, and I didn't faint. I performed at his master class, but at the next NFA, which I think was in Washington, D.C., there was a booth of Sam Wesley out of California had a vertical flute he had patented, and he put the lip plate on the end of the flute rather than, and you played, and you know, I worked with him, added a neck strap, and I was the first to record with that instrument. But nowadays, well, he since, rest in peace, has passed. But nowadays there are other ergonomic flutes, and you probably have seen them at NFA, which I would recommend considering. Maybe the way I used it often was when I tightened up or started to have pain, I would switch to the other instrument. I didn't have the same facility on the other instrument for a long time, but I would just do simple exercises on the ergonomic flute. I eventually, you know, where I could play it. But it's one in the newer ergonomic flutes are a lot more responsive and easier to play. So that is a very viable alternative if economics will allow.
Thank you so much, Tip. Great insight there. We'll move over to Rena.
Hi, Catherine. I'm going to add something, an addition, some more stuff for you to take notes on top of what my colleagues here have added, which is all really great information. So, you know, because of, like Simone said, the necessity of the ergonomics of our instrument, something has to give. Like either we're back here with our instrument and we're creating an imbalance with our shoulder blades, bringing our right arm back further, and our shoulder blades aren't really able to glide on our back side with balance and ease. So either we're doing that so we can kind of stay facing forward, or we have to do the opposite, which is pivot that right arm around a little bit so you can see your right hand and the end of your flute and your peripheral vision off to the right, and have a gentle turn to the left. So a couple of things, well, maybe three things. One is, can you think, I mean, I'm not watching you play to give you really any information with specificity for you directly in watching you play in this moment, but can you like notice the way in which you sit or stand? And can you, when you bring your instrument up, can you allow your head to turn to the left so you can navigate your instrument, but in a way that your head leads your spine? There's going to be a natural turn to the left, right? For most of us, unless we have to make adjustments for something else with our own personal anatomy. The other thing is, can you in your practice, I mean, obviously in rehearsals, you can't do this. You can't be like, hold on, everyone, I'm going to go lay in constructive rest backstage. They'll all look at you like, what What are you doing right now? But in your practice room, can you take practice breaks, like no more than 20 minutes at a time? I'm a fan of shorter practice sessions. It keeps you mentally and physically fresh. And then go lay someplace on the floor where you're lying on your back, knees are bent, soles of your feet are on the floor, and you just give your body a chance to be supported by the floor. You give your head and your spine and your pelvis an opportunity to kind of find a place of neutral with themselves, and it's a nice resting place. So that I would say any gentle movements that you feel comfortable doing, that you can integrate into your life, like Jackie was suggesting, but maybe just super gentle stretches before or during or after your practice, doing some cat and cow, getting on your hands and knees and taking your spine through cat and cow shapes, where you're taking your spine through, all of that mobility, and then sitting cross-legged and taking some seated twists. And you're going to notice immediately where you feel more mobility and where you feel a little bit of rigidity, a little bit of limitation. Not necessarily pain, but you're going to be like, whoa, when I do a twist to the left, man, I got a twist to the left for days. But as soon as you go to twist to the right, you'll be like, why does this feel different? Well, because there's a natural asymmetry, right? And then the final piece I would say is, depending on where you live, you might visit the bodymap.org website and see if there is a body mapping teacher that lives in your community that you can connect with and set up a lesson where you can have, or an Alexander teacher, somebody that can watch you play and see if maybe there's something that they can offer, some guidance, some good tips for how you're seated or standing. And maybe it's the simplest micro adjustment that will make all the difference in the world.
Brilliant. Thank you so much, Rena. We do have a final question, but Chip, would you like to add something there?
Yes, Rena reminds me that a few years ago, I did at NFA in, I forget where, but I did a workshop on some of the things Rena was just talking about. It was titled "Playing the Large Flutes Without Pain." And I'm pretty sure there's a video on our YouTube page. And I've also done, for the New York Flute Club, where I'm on the board, a session workshop of the same title. And there's a video on the New York Flute Club's YouTube page as well, incorporating some of the things that Rena Urso just mentioned, and some of the stuff that I've gathered, collected over the years as a aspiring jock. I don't know, athlete. I still do a lot of athletics and exercise. That was my music, and athletics were my first love, but couldn't figure out how I was going to make a living at it. So I went to orthodontics as backup. So yes, if you want to access those videos, I think they're available.
Thank you so much, Chip. And I think this next question, which I'm going to read out, might be particularly applicable to you as well, Chip. So if you find Emily's message in the chat, I'll read it out here. It says, I sometimes have trouble with my jaw feeling tight and locking at times, and it interferes with my flute tone quality. I've looked into Botox for my TMJ, but decided against it since my TMJ spikes when I'm stressed. What are alternative ways to deal with this jaw tension? And Chip, perhaps your orthodontist expertise could extend here to, considering I'm sure you deal with a lot of people with jaw pain and TMJ in particular. Could you speak to this question?
Yes, TMJ, temporomandibular joint. We're using it all, which that mechanism is being used all the time when we're playing musical wind instruments, especially and particularly flute. So it's a subject that it's a delicate subject, and there are answers, and there are exercises, etc. And anyone who has concerns about TMJ related to flute, please email me at chip@chipshelton.com, chip@chipshelton.com, and I will forward you some of the articles I've written on the subject with exercises and prevention tips, and some of the medical things maybe to consider and maybe some to avoid, etc. So chip@chipshelton.com for anyone who has TMJ questions, and I'll try to get some information out to you.
Thank you so much. And of course, jaw tension can often be caused by or part of other body tension issues as well. Perhaps someone on the panel here could speak to that.
I guess, sorry. I can start with like my own experience with TMJ. But the first disclaimer is, as I said before, for those of you who were not here, I do have Ehlers-Danlos syndrome, a connective tissue disorder that primarily affects your ligaments and joints. So my jaw is going to have a lot more tendency to dislocate or unlock or like be out of place, and that's where the locking happens, right? But I know that a lot of people deals with TMJ, and many of the treatments can be similar, whether or not you have EDS. I would say some of the things will be, there's a lot of exercises. I think Emily is the person that will ask the question. There's that little ball that you can find that has a little spikes. You can massage yourself, your face, to like release the tension. But what really, I don't want to say that cure me, but really helped for me was actually doing prolotherapy injections. So you will have to go to somebody who actually knows about it. I did it with a performing art health specialist who does it. She's based in Fort Worth, Texas. I don't know where you are, Emily, but she is fantastic. Basically, what they do is like they inject a solution that has sugar, sometimes other things, and water, and they inject it into the place that is injured to jumpstart healing. And then so you can like swell in, there's some swelling happening in the muscles, then it's gonna help release after. So it kind of hurts a lot at the beginning, and then it gets much better. But as somebody who dealt with like really serious TMJ for a long time, that was something to help. So just a recommendation to look into it and do more research, see if that's something that actually can work for you.
Thank you very much, Gabby. We'll move to Stephen. I am aware that Judy, you've raised your hand.
Yeah, just a quickie. What's interesting is that this is one of the things that one of the PAMA committee tried to look at was getting the initial teachers involved in the elementary schools. Because one of the big problems, and I remember when my wife was an elementary band director and having to bring the kids on, is she would look at and decide, okay, that kid could play clarinet. This one's for brass. This one is for flute and what have you. Because if you force a person's anatomy to play an instrument they're not designed to, you're going to have a lifelong aches and pains and problems and things like that. Secondly, is having the teacher, a really good independent teacher, work with you to make sure that you're doing it right, not sticking your jaw out like a bulldog trying to get whatever embouchure they think is the correct one. For a while, we had at the NFA, we would have a booth where this gentleman would be making specially designed flute head joints and lip plates for you and put it on your flute. And unfortunately, he died of COVID a couple of years ago, but it was absolutely amazing what a difference it made in the people we saw. And so the catch is, yes, relaxation is vital. Not having extra stress anywhere in your body is vital. Having the proper equipment to match your physiology and your body and your anatomy is vital. The problem is getting them all juggled together, and it's not easy.
Yes, Rena.
Feel like every single one of my injuries is being called called under light today. TMJ is the first big issue, big obstacle I had with playing related pain. And it started for me in, I think, my second year of undergrad at Wayne State University in Detroit, where I grew up. And at the time I was studying with Clem Baroni, and Clem was like, you know what? The NFA has a committee. It's called the Dysfunction Committee. Right, Stephen? And I reached out to the chair at the time, which was Leon Bisey, and she gave me a lot of really, really fantastic information because I knew nothing. And back then, you did not talk about injuries or any of that. It was like all quiet. Like I went to my lesson and I was terrified to even tell my teacher because I thought I'd get in trouble. Like, really? But that's where my head was as a 19-year-old undergrad flute student. So my first step was an orthodontist, well, my dentist, then an orthodontist. I had the custom bite splint made. I lost it. I had another one made because, you know, when you're 19, you're not super responsible for a $500 piece of plastic. So I think I threw it away on a hospital tray, and my dad was like, oh my God. So I went through a couple bite splints. I went to a kinesiologist. I went to physical therapy, and I would feel great for a while. And then I'd get back home, I'd get back with the instrument, and it would take me, I go back to square one. So again, it was something I was doing that a teacher had to watch me to be like, did you know that you're doing this with your jaw when you play? So the doctors would put me back together again, but it ultimately came back to, I needed to figure out what it was I was doing habitually that was creating the problem. So all of that was good. And it led me back to my practice room and someone that could give me some advice and help me to identify, to map, if you will, where the appendage of my jaw lived and where those jaw joints were, and how to find a little bit more free and easy movement, and to undo some of the habits I was doing when I'd play flute and piccolo and replace them with better habits. The other thing that helped with my pain was, because this went on for years, was acupuncture. It really helped me to deal with the migraines that I would get as a result of the TMJ. But finally, I got through it from all the combinations of things, and ultimately figuring out what it was I was doing, like Stephen said, like some unhelpful jaw movements when I was playing my flute and piccolo that were creating more harm than good. But fortunately, I got to the other side of it, and and then I found a new thing to hurt my body. Sorry, it's true though.
Thank you, Rena. Just in the interest of time, and I see Judy's hand is raised. Let's move over to Judy. If you have a different question or something to add, please go ahead.
Just something to add. As I sit here listening to all these musculoskeletal things, I'm a physical therapist and I do TMJ work, and not all PTs are the same. Some people do minimal hands-on type of treatment. And I do a lot of manual therapy. I include cranial sacral therapy. I can do dry needling. And so much of that is much more natural, helping the body to get balanced out and become much more functional than like having to lead to Botox or something like that. And then if the body can get balanced out a little bit more, then following through with like the body mapping. I've only had one little session with the lady at NFA a couple of years ago, and I wish someone around here would do that for my own playing as well. But I think the whole complement of a lot of type of systems, because the jaw isn't just the jaw, it's part of the neck, the head, the upper body, the breathing function, all of that. So I think was it Emily that requested that question, that there's a lot of alternatives that could come together for her.
Absolutely. Thank you very much, Jackie. Judy. Sorry, and now Jackie.
Well, and Judy, I really appreciate that you talked to us and brought that up. And I think it is something that need to be reinforced also for everyone, to check with your medical team, when you're having problems, and please go to a physical therapist. I know with my own health, I was referring pain, And so what I thought was musculoskeletal was not. And it was because of the physical therapists and the due diligence of their work, that the real problems were better identified, which changed the whole medical trajectory for me. And my symptom management. So even if you think, you feel like you're figuring it out, because backs hurt all the time, shoulders hurt. Like she said, your jaw's connected to your neck. We're just carrying all of this tension here, and then vagus nerve comes through here. There's a lot of, it's easy to just miscalculate that and think that it's something else. And that's where these experts are so important, because their diagnostic criteria is going to look for things that we're not aware of if that's not our field. So thank you for adding that.
Judy has just put in the chat, Chip, could you please provide your direct email address? Perhaps you could type that into the chat. And this is a good time. We're here in the final few minutes now of the panel. I'd also like to include in the chat, I've just put a link to our Performance Healthcare Committee page. On that page is where you can submit an anonymous question to the committee. Underneath is, again, I posted this earlier, this is just a repeat if helpful, our specific Gmail address. If you would like to get in contact with a specific member of the committee, you can certainly do that there, or an email to address the entire committee if you're not sure, if you would like to find out who could further help you. And as we're wrapping up, I've been taking some notes. I like to try and summarize a panel or a webinar where possible. And I think we've covered 4 main key things today. And the first one being advocating for our needs. If you need to take your flute along to a session to demonstrate, I think that was such a good point made, I think particularly by Stephen and Rena as well, that they might not know what it takes to play the flute. So advocating for what you need as a flute player, don't be afraid to take your flute along. The second one being educating ourselves. Maybe that is we need more awareness of what is happening in our body and where pain is coming from. But also, as Stephen mentioned, we might have to do the book learning ourselves to then take it to our medical practitioner to help them along our journey. The third aspect being adjusting where possible. We've heard about amazing different types of flutes, but making adjustments to our schedule as well, to our practice sessions, things like that. And then finally, connection. I think we've heard a great call for connection. That's why we hold these webinars, why we have our fantastic committee. And I think there's more that we can do. We will certainly look forward to what we can hold at perhaps a convention or a future webinar. This is not the first of these Q&A webinars, and I hope certainly not the last. So that's what I think 4 main things we've taken away from today. We are here in the final minutes. Please save the chat. There's lots of links and things like that in there as well. If you'd like to save them, please go ahead and copy them or download the Zoom chat there. Take a screenshot perhaps as well if that is helpful. Otherwise, I'd like to start wrapping up and just say thank you all so much for attending today's webinar. We've really enjoyed talking with you. You know how you can connect with us. Please do if you have follow-up questions or other questions, or you know people who might like to get in touch as well. Otherwise, we look forward to staying connected with you. Thank you to our panelists and to those of you who joined, asking questions, just being here. Thank you. I hope you have a lovely rest of your day.